Hello, everyone, and welcome to this Mental Health Academy Fireside interview on helping clients navigate modern challenges through the lens of trauma prevention. My name is Pedro Gondim. I'm Mental Health Academy CEO and your host for today. And joining us is Dr. Cirecie West-Olatunji. Cirecie, thanks for joining us. How are you today?
I am very, very well. Thank you so much for inviting me.
It's a pleasure. It's another conversation with you. That's always good. It's been a few years of these wonderful little chats and presentations now, so it's always great to connect. And for those of you that haven't seen Cirecie in action yet, you are in for a treat. But before we get to that, let me just start with giving you a bit of a background on your presenter. Well, not presenter, because this is not a presentation, but a Q&A fireside. So your, co-host today. So Dr. Cirecie West-Olatunji currently serves as the CEO of the Stressors program, and I'm going to drop a link to the website soon via the chat, and it's also going to be on the session notes. Dr. West-Olatunji is the founding director of the Center for Traumatic Stress Research at Xavier University of Louisiana and a past president of the American Counseling Association and the Association for Multicultural Counseling and Development. Dr. West-Olatunji has initiated several clinical projects focused on culture-centered community collaborations designed to address issues rooted in systemic oppression, such as transgenerational trauma and traumatic stress. She has conducted commissioned research under the auspices of the National Science Foundation, the American Counseling Association Foundation, Kellogg Foundation, Federal Witness Assistance Program, Spencer Foundation, the American Educational Research Association, and the African American Success Foundation. The publications include 2 co-authored books, numerous book chapters, and over 60 articles in peer-reviewed journals. Dr. West-Olatunji has also coordinated disaster mental health outreach projects in post-Katrina New Orleans, Southern Africa, and Haiti. Finally, Cirecie is the creator of 2 internationally acclaimed Mental Health Academy credential courses, Working with Trauma, Interventions that Foster Resilience, and Disaster Mental Health Counseling. Cirecie, that was a lot. Anything else that I've missed that you'd like to add?
I am recently retired from my academic life, and that it looms big. So that's what I think about most days, how happy I am.
Wonderful. And for those of you that were wondering about that, Cirecie was a professor for many, many years and did a lot of academic contributions at Xavier University of Louisiana, but now she's off to more fun stuff. But before we get started with the session, we had enough of Cirecie for the time being. She's going to tell a little bit more about her background when we start the conversation, but I just want to give you participants a very quick overview of how this session is going to work. So we prepared a number of questions for Cirecie, and we'll combine these questions with questions submitted by live attendees. So if you are live with us now, you can submit a question at any time during our chat using the Q&A tab on your screen. And you can also interact with your peers and our team by the chat tab. So the second thing you should know is this session is being recorded, and a link to the recorded as well as a handout that we prepared especially for you with some useful links, including journal articles, videos, and more, will be mailed to you approximately 1 hour after the conclusion of the webinar. If you are watching this on demand, you should see the links in the appropriate channels that have been shared with you. Finally, if you need any support, drop a message in the chat or email us, and we'll try to help you as soon as possible. Now, that's enough of intro. Cirecie, I am going to start with our questions. And I guess the first question is a bit more of a background and taking a deeper dive into you and how you got into this field. So why don't you tell us a bit about your professional background and how you became who you are today in terms of professional endeavors?
Yes, gladly. Well, I would say, some people would say, I wouldn't say, but some people would say I was a late bloomer, meaning that I discovered mental health counseling very much later than my peers. So for a lot of people who know exactly what they want to do, they go to college, then they go off to graduate school, and they know exactly where they're going. I did not. I had an opportunity to work in several environments, but it wasn't until I took a position at a medical school and I was working in sort of a dean's office position where my job was to make sure that the medical students were able to overcome any obstacles that might be in their way. So these were very bright students. They were picked because they were what they, called creme de la creme. And then sometimes they had difficulty. So I started, really understanding what causes that. And I decided to take a course at a local university, turned out to be Columbia University in New York. And I started taking psychology courses, and they were actually counseling psychology courses. And I fell in love. I could not believe that there was such a profession. It fit me like a glove. This was my passion, and I started from there. So I eventually earned my master's and my doctorate in counseling, and with the goal of becoming a master counselor. I thought, well, if I'm going to go into this field, I'm going to be the best. So I did everything extra. I just, whatever was required, I did more. And I really had that as a goal. But somewhere along the way, one of my professors asked me whether or not I wanted to get a doctorate and really think about becoming a professor. And that changed the trajectory. But what I was interested in never changed. I was always interested in what is it that causes people so much distress. So why is it that people experience trauma, stress? What crises cause that? And why did it happen to this person versus that person? And I continued that. So as I continued my clinical work in private practice, I also began researching this issue of trauma and developing interventions. And so I spent a lot of time not only working in micro settings like a private practice, but also developing programs in communities where I saw a need. And it was either adding programs to an existing agency, or it was starting something from the ground up, developing something in public housing or in a church, and helping a church to develop a counseling center within the church that connected people to their faith, but also very concrete things that they could do to change their lives. So I've spent literally my professional lifetime researching and intervening with individuals, families, and communities around this issue of trauma and stress.
Thank you very much, Cirecie. Very interesting journey, and I'm sure there are many aspects of it that hit a note with some of our attendees here, many of our clinicians. They probably have gone through similar experiences themselves. So in this conversation, we're going to cover a broad mix of topics, all of which have a common thread, which is traumatic stress. But before moving to specifics, I think it would be useful to clarify some of the basic terminology. So how would you define stressors, traumatic stress, and trauma? And what's the interplay between them?
Yeah, so stressors are generally those things, those events, those activities that can cause distress, emotional disturbance, or psychological, even cognitive disturbance. So these are these activating events or experiences that would cause distress. They don't need to be intense necessarily. They could be mild sort of forms of distress. But these are sort of factors that we can look at to see what might have impacted this person, right? Trauma is very different. Trauma tends to be more of a clinical term in that sense, where we look at trauma as something that causes intense psychological and emotional responses. And it can include perceptions. So it doesn't necessarily include something that might happen to an individual. They could perceive it as harmful, and it can still cause that kind of distress. And it can come in various forms based on certain situations. It could be how close was the event, the stressful event or activating event, physically close. It could be how did it happen? Was it malfeasance, meaning someone was malicious and they did something, or even an entity was malicious. It could be a government organization. It could be a corporation, a company. It could be your job. It could be something that could be a policy, for example, something that is done intentional that causes harm, could also be something that causes trauma. And we can also witness. So we could think of perhaps an industrial accident. It could happen to the person and it's a traumatic event, it's trauma. But those who witness it as well can be traumatized by an event. And then also we have certain groups of people who also experience things collectively. So there's things like collective trauma, there's cumulative trauma. So there is complex trauma. So once we start understanding trauma, we can look at the various types, the intensity, the source, and so on that causes it. Even when we think about something like natural disaster, when we think about the types of disasters that occur and how they happen and the responses to those things, we can get very differential kinds of responses to that. So that's stressors, trauma. And I think you asked about traumatic stress. Traumatic stress is very important because it really is the next step in talking about trauma. We have very standard, conventional terms that we use and training that we receive around trauma, but there's emerging literature around chronic trauma or continuous traumatic stress, right, that looks at the pervasiveness of trauma. And unfortunately, because of several things that are happening in the world right now, like a pandemic, for example, that doesn't go away. It is an endemic, but it still is this little scary thing that's out there. We also have long COVID, and we also have people who are experiencing grief, chronic grief, because there was a period in the world in which we were experiencing so much death as a result of the pandemic. And so this has created a lot of, new areas for us to look at as this pervasive trauma that we're experiencing. Another would be looking at the environment and looking at the impact of global warming, climate change, looking at that is causing a lot of anxiety for people. And so that, I would say, is moving into this area of traumatic stress. And so we really do need to think about how do we, as mental health professionals, how do we prepare society? How do we prepare the world for responding to these chronic and pervasive forms of stress that we'll be dealing with in the 21st century and beyond?
See, and you've mentioned several strands of topics within trauma that we will discuss today. So we're going to have a few questions for each of them. But the next question is with regards to resilience. So why is it so important to talk about resilience when discussing traumatic stress?
Well, Pedro, that's a very important issue, certainly from a humanistic perspective. And as a counselor, educator, as someone trained in a humanistic mental health area, we believe that human beings are very powerful and have the ability to resolve their issues, and that we support them. So this is a very strength-based approach to engaging in mental health, to think about human beings not only in terms of the challenges that they're experiencing, but to see them in totality. People are more than the issues that they bring to you for assistance. They are, also very capable in other areas. And they also have more knowledge, more in-depth knowledge. They have thick description around their problem and probably can identify solutions a whole lot better than we can. So we facilitate in that sense. And so when we think about trauma and resilience at the same time, it's a reminder to us to stay humble, to recognize that we are not superheroes in that sense, that we have all the answers and we fix people. Not at all. We facilitate that change and transformation for people. And we have to acknowledge that they are more than what they're presenting. This was presented to me when I started my work around trauma. I was presenting somewhere and a physician came up. I think he was a neuroscientist. He came up to me and he said, "Beautiful presentation. I really love what you're talking about, and it's very important work. I do want to offer some suggestions to you." And as the room cleared, this physician and I sat and talked in that room with no one else in there. And he shared with me, and one of the most important things that he said to me is that whenever you talk about trauma, talk about resilience. It's very important that we never other people, we never look at them as not being capable of solving their own problems, and to remember with humility that we just assist.
It sounds like I think also an important way to develop someone's identity, for every, I guess you can say the whole yin and yang concept, there's a positive to every negative and vice versa. So there's always an upside to trauma, which is the resilience that you have within you is always with it. Every experience of trauma, there is an opportunity for you to utilize or grow your resilience. So looking at those two factors and not identifying yourself as the traumatized person, but the traumatized and resilient person.
Yes.
And then using your focus when, sometimes you just need to let the trauma, let those emotions sift through. But other times you need to look for solutions. And it's important to keep both in mind at all times, as you've alluded to.
It's true. And that not only speaks to the client, but it also speaks to us as therapists. So when we engage in a relationship with our clients, we remove what's known as the I-thou relationship. Instead, it becomes very horizontal, meaning I am witnessing as a human being, I am witnessing what it is that you're experiencing, and I'm appreciating it as a human who marvels at the way in which human beings can transform themselves, who can create change, who can turn themselves around. And when we see them in that sense, we become more present in the session rather than sort of being behind this invisible wall of I'm the professional and so therefore I'm working on you and you've got a problem, I don't. We're not doing that. Instead, we are there witnessing how amazing humans are in being able to be corrective, in becoming and self-actualizing. So I think it also includes that, not only what's happening for the client, but it's also what's happening for us and our ability to genuinely connect with other people.
I see. Looking at both your clinical experience and research work, what are some of the most common reasons people experience traumatic stress nowadays? And how does that compare to a couple of decades ago?
Wow. That is where I am right now. That's where my head is right now. as I engage with people, I do a lot of keynote speeches for conferences. You can imagine a lot of trauma organizations ask me to come and speak for them remotely, in person, and so on. So I get an opportunity to sort of check in with people, not only locally in the US, also in other places. And I realize, or at least I'm experiencing it, as we're sort of heating up as human beings, that I would suggest that one, COVID had much more of an impact on us than we are willing to admit. And so we have a lot of residuals from COVID that we are not dealing with head on. And it's causing a little bit of a disturbance. So I find that people are less tolerant, they're more irritable. We definitely have cognition issues, fugue, the brain fugue of people constantly saying, oh, I forgot the word, or I can't remember. It's happening so frequently with brilliant people. And so there are a lot of signs of trauma that we have not really addressed. And I suggest that we need to have more rituals in which we really punctuate what happened, how we feel about it, in order for us to move on. We can't move on by just saying we want to move on. We have to get our minds and our hearts ready to move on. And we're not there. That's true for us as adults. It's true for the children and the developmental losses that they have from being out of school, issues around their ability to interact with human beings. So their relational skills have not quite caught up to where they need to be. There are just a lot of issues that we need to sort of go back and fetch it. We need to really catch up with where we want it to be, or should be, or would like to be. So that's one of the things that is causing disturbance, and we're in denial about it, I would say. Another thing is that, oh my goodness, the kind of political strife that's going on in the world is very problematic. And more so for young people, because it's starting to rob them of their sense of hope. And what the youth need more than anything else is a sense of hope rather than hopelessness. That could account for why suicide rates are up significantly, drastically up. And in the United States alone, suicide rates for young people, for adolescents, has doubled every 10 years. That's alarming. That's without looking at the impact of COVID. So something is happening to young people, and part of it can be explained by, looking at what's going on in the world. Third, climate change. Again, this is something that would impact young people and their sense of hope. It's a very unhappy, very, very disturbing circumstance when human beings are not all hands on deck to be able to change our trajectory. We've got some countries that are doing very well, and other countries with the resources are doing not as much as they should. And for young people, it is very discouraging, disparaging for them, and it contributes to their sense of hope of, why are people checking out? Why are young people not only despondent, but they're checking out? Emotionally. So part of that has to do with the fact that they feel, why try when we won't have water in 20 years? We won't have clean water. We won't have clean air. Our crops will be impacted, and so on. So there are quite a few challenges in the world that are cumulative to our normal stressors, like just growing up and growing old. Let me put it like that. Growing up, growing old is stressful at every point, maybe more stressful during adolescence, but in general, as we transition from one phase to another, it's difficult. We have to acquire new skills. We have to grieve over things that we can't do anymore. And the losses that we experience. Also, if you've had any trauma, typically as we move through our developmental stages, we revisit the traumas and may have some triggers as we go through those. So just growing and developing is a challenge and can be a stressor in of itself. Relationships are stressful. Even when they're good relationships, they're stressful. It may be very beneficial to experience that stress, but it exists nonetheless. And so we want to work with that. And if it's a great relationship, I think we are rewarded for the work that we put into it. If it's a relationship that doesn't have the equanimity, it has more problems than it has benefits, then it complicates things because sometimes it allows us to get into a rut that is familiar. So if we've had a rough earlier life, we tend to have difficulty resolving these conflicts when we're later in life. We may have poor coping skills, we may be maladaptive, and then we will use those same maladaptive skills and wonder why we can't be happy. So there are quite a few challenges that we have that are new, that are on top of what are perhaps ordinary challenges and stressors.
Thank you very much, Cirecie. Trauma treatment is often seen as a reactive approach to a traumatic event. Are there ways clinicians can adopt a trauma preventative approach in their work with clients? What does that look like?
Great question. First, I want to say I talked a little bit about this in the Micro-Credential program in talking about what we need for the 21st century. I think I also talked about it in the disaster credential program about prevention and why is that so important? Well, first of all, it should always have been important. And unfortunately, where we started in our training in mental health was very reactive. And it's only been recently that we've been thinking about prevention as the core of what we do. But when we think about what will the challenges be in the 21st century, prevention is going to be necessary because we will have uber disasters, right? So back in the early 2000s, one of the things that I talked about, what I wrote about, what I was experiencing, what I was providing training around, was this issue that with climate change, we are going to have uber disasters. And I understood that right after Hurricane Katrina hit the Gulf Coast and New Orleans, right, during that time period, that would usher in a season. We're in that season where we have uber disasters, many of them related to climate change. And how we respond to those things has to be different from what we've learned from the training that we've previously received. People are going to have to save themselves. The impact of these uber disasters, these huge catastrophic disasters that get bigger and bigger every time, will be so large that the helpers will be as impacted as the people that they serve. And we will not have the human resources, the professional army of people that we typically have, even in the most industrialized societies. It's not going to happen. We've already seen that. We saw that with Hurricane Katrina. We definitely saw that in COVID. And so we need to understand that what we need to do is to train people to live differently. We need to live a life of prevention. And I believe that neuroscience provides us with the answer to that. So I've been writing a lot and talking a lot about enduring self-care. And so someone said about Uber disaster, it's using the German word, for catastrophic or huge, big, gigantic. They talk about Uber disasters, right? So what we need to do is to teach people to live differently, to live in a way in which they prepare. One of those is really being able to manage our emotions. We're going to be challenged by a lot of things. So the question is, how do we respond to those things? How do we manage? How do we maintain our ability to perform in the midst of challenges? And so we need to learn how to do that. And so a lot of neuro counseling techniques are designed to help us to be able to do the emotional regulation to maintain our ability to perform so that our thinking isn't compromised, that we can problem solve a whole lot better so that we are not immobilized by what it is that we're experiencing, and so that we can stay on top of our game and be helpful to other people. So prevention is really about being in this space where we utilize the techniques that rewire our brains to be able to stay functioning, to be able to respond to a lot of these, issues that are going on. So that is the bulk of it, really. About prevention is really about changing your lifestyle and changing the way in which you deal with things. And a lot of that is developing mindfulness techniques. It is like it's armor. It really is armor that arms us against a lot of the attacks of things that happen out there, whether it's individuals or institutions, policies, or whatever. Mindfulness serves as a form of armor for us to be able to deal with that. So prevention really focuses on those neuro counseling techniques.
Thanks, Cirecie. And I've got 3 follow-up questions on that one. Firstly, you've mentioned the neuro counseling techniques. Do you have some names for some of those techniques that we could just bring up here for people to look into?
Yes, absolutely. Definitely when we're talking about some of the broader things to do, we know that, believe it or not, things like breathing and understanding, I would say enrolling. So it's not just regular breathing. So I would say for people to, if you're working with clients, I would say go and get some training around breathing as a form of mindfulness. And you can teach your clients to breathe in such a way that it allows them to emotionally regulate. And that's important. The second is thinking about the various forms of mindfulness that are out there. A lot of times people think mindfulness meditation, and meditation tends to be this very formal experience that's very difficult to do and so on. But I've taught courses, and I am not a yogi. So I am not a person who is has gone in that direction. Instead, I stay in my lane around the use of neuro counseling. So what I do is teach people to do mindful walks, for example. How can you walk on your day or for exercise or to get to work, or to, go see a friend, or to get groceries? How can you walk in a way that that sharpens your ability to stay focused, and also is a way for you to relax? So I teach people to mindful eat, for example, and be able to do that. Now, these are all things that what we call are the enduring self-care, which is very different from the temporary. Temporary is people tell you to exercise, and exercise is great. Exercise is good. In general, exercise is good. But if we're doing it because we're experiencing distress, that good feeling, the endorphins, tend to recede after a couple of hours. So that's why I concentrate on enduring. People say, listen to music, same thing. It has a great impact, right? But only for a few hours. Take a bubble bath, same thing. Feels great, but only for a few hours. So we actually want to rewire the brain, that we have to do deeper work that really doesn't take a lot of effort. Really, like I said, you don't need to go onto a mountaintop and cross your legs and, meditate for, hours, and so on. You could just do these small things and they will make a huge difference. And we know that, of course, has the support of science that allows us to feel comfortable about those things. We also talk about body scans because we want to be aware of where are we experiencing the stress in our bodies, right? So a lot of people have embraced the idea that we carry the trauma in our bodies. Absolutely true. And so learning how to do a body scan, again, helps individuals to regulate their emotions by checking in with themselves and being able to do that. Now, this does not mean that people might not use their theoretical frameworks to engage in therapy from their particular perspective. So for instance, cognitive behavioral therapy, that works, that's good. I'm just saying that when you couple that with some of the tools from neuroscience, that you're likely to have more enduring and lasting effects of the work that you do, and help clients to work on their own. They don't need to be with you indefinitely. They can do that work on their own. Narrative therapy is also extremely helpful as well in working with clients who experience various forms of trauma, because we allow them to restory, for them to be able to come up with a different ending to their story. They get to analyze and critique their life stories, the story that they tell. That takes them to their trauma responses, and they can retell that story in different ways to have a better ending, and so on. So those are done. Of course, when we think about trauma and relationships and thinking about families, whether it's parent-child, whether it's, romantic, committed relationships, or it's siblings, young siblings, adult siblings, whatever the combination is, certainly if you have not been trained in family therapy and systems therapy, I would encourage you to do so. There are lots of times when I've worked with clients and have decided that a family session is going to address this issue more expediently than continuing to work with just the individual. And of course, I had training in that area. When I was in private practice, I was active. I was also a licensed family therapist, as well as a clinical mental health counselor. So I think that is something that people can use in order to try to dislodge a lot of the deep-seated concerns that cause complex trauma.
Thank you so much. See, and I'm actually going to share a couple of things here on the chat. The first one is the YouTube page for the Xavier Center for Traumatic Stress, because that has a few short videos with Cirecie on lots of techniques to work with children, for those of you that are working with children and trauma. Secondly, also a recommendation. There is a Mental Health Academy credential course with Dr. David Trelevan, which focuses on a lot of resilient techniques around the window of tolerance. So a lot of that neuroscience-based meditation, mindfulness techniques to increase your clients' window of tolerance. So have a look at the MHA website. Just look for window of tolerance in our catalog, and you see some resources there in that course. See, the second follow-up I have for that question is when a client comes to you, because you mentioned the importance in terms of prevention or having a sort of holistic approach to health and well-being. When a client comes to you and you want to assess them on that, do you have a preferred tool or framework that you use to look at all the areas of their life and see where they're at and then make adjustments based on that?
Yeah, there, of course, are a lot of tools that one can use for assessment. There's a daily life experiences scale. That's one that just sort of takes a look at, holistically what's going on, and to allow people to talk about what's happening. I think a common trauma assessment is called the Trauma Screening Questionnaire. And so the TSQ, that's very commonly used. One can go on the internet, actually, and there are a lot of self-assessment tools out there. So if you as client, you as therapist wanted to go and just sort of quietly find out, how am I doing? Should I reach out to a professional? You can do that. There are also some specific ones that I often use because a lot of times I'm looking at pervasive trauma like race-based stress, historical trauma. And so fortunately, after about 20 years of research, we now have scholars who are producing these assessments that are very specific. So for those of you who might be working with culturally marginalized communities, there are a couple of scales for historical trauma. There's historical losses symptom scale. And there's also, that's just one, there are a couple, but there are maybe about as many as 15 race-related stress instruments. One is called the Index of Race-Related Stress, but there are many, and there are some that can be used with children as well as with adults. And I've used these, they work very, very well. So those are some, but, oh, that's great. Folks are putting in other tools. So I encourage you to take a look at the chat because you're getting more. And the more we have, the better we're serving people. Also say that there are some clinical tools that you can use. Believe it or not, I have used the feelings wheel. You can get right off the internet, the feelings wheel, to just have people to assess. And I've thought about it in a lot of different ways. I've asked people, of course, to identify what they're feeling right now, but we've also used it to scale, to see how they feel over time. So we can check in weekly, monthly, when they return, maybe a year later. You can take a look at where they place themselves there. You could ask them about how they feel about certain events so that you get a cluster of feelings. And sometimes you can see that the feelings are more in the range of sad and mad than they are in glad or surprised or content. And to have them to really become familiar with feelings, to be able to self-assess, self-critique, to monitor You can't emotionally regulate if you don't understand feelings. And also get a history of feelings, like where did you get the idea about feelings? Often people look at the feeling wheel and they say, well, I don't want the bad feelings, I want the good feelings. And we have to remind them that all of the feelings are necessary to be fully human. And it takes a while for them to let that settle in. And then we get to talk about, well, where did they learn that? Where did you learn that there are bad feelings? Tell us a story about, where you learned that or when you learned that, and what were you doing? How old were you? And so on. Those things are really important. So I find that there are some clinical tools that can be used that help us to assess where someone is in terms of trauma. I think that what really impacts me is an article I read about 25 years ago now. And it was talking about how often health professionals, mental health and physical health professionals ask clients about trauma. And the number was something really low. It was, maybe about 15% of the time that they ask about trauma, regardless of what the person came in for. But when I asked the clients or the patients, how often was your presenting problem connected to trauma? They said about 75% of the people said it was connected. So I think about that mix match a lot in thinking about the training that we need to have, how we need to enhance our ability to deal with trauma. When we've looked at the studies of why professionals don't ask about trauma, we recognize that, one, we have experienced trauma and we therefore avoid. We don't want to have certain feelings or there are issues that we haven't resolved. And so when we get a hint of trauma, we run, so we don't ask about it. Another is that professionals said that they didn't feel capable enough to be able to address it. So again, they ignored it or avoided it because they didn't feel competent enough to be able to deal with it. Some of the other reasons I think are more procedural or practical. Often people said they didn't have time. They knew that the responses would take a long time, and they didn't want to take the time. They wanted to try to get through the list of number of people that they needed to see. So there are real issues that we have around this. I don't think the issue is that we don't have assessments or they're not out there. I think that we just need to feel more comfortable talking about and addressing trauma in the lives of our clients and in our own lives personally. Yeah.
Just one more follow-up on this topic of assessment tools. How do you assess the severity of traumatic stress in your clients? Do you have any specific tools or scales that you find most reliable to use in the clinical setting?
Yeah, many of the ones that I mentioned, for instance, I talked about the trauma screening questionnaire is my go-to. It really is. I like using that a lot, and I'll pull that out. If I'm working with clients of color, I tend to want to use instruments that have been norm referenced on non-white populations. And so I have a list of those as well that I would pull out. I mentioned the index of race-related stress. And also I mentioned the daily life experiences scale, which is one that has been norm referenced on non-white populations. But yeah, my go-to just in general, if I see trauma screening questionnaire, and also there's a whole list of instruments that can be used with children and working with them around trauma. But there are also clinical tools So don't miss out on those clinical tools with children. And I talk about that in some of those videos that Pedro has given you the link to on YouTube. And, just drawing, asking children to draw a picture, and they can draw a picture of anything, whatever is on their minds. So that's helpful in being able to do that. But there's also Draw Family, right? So there are a lot of projective types of drawings that children can do that are forms of assessment. So I personally don't rely exclusively, solely on the objective tests. I also use the subjective clinical assessments, and don't overlook just a clinical interview of just talking with people and asking about their environment and their experiences. To talk about work, for example, we have a lot of workplace stress as well. And so we want to talk to them about that. We have a lot of folks in my age group who are dealing with aging parents. And being a caregiver to aging parents is extremely stressful, as much as we love our parents. So I would say don't overlook clinical assessments.
Thank you very much, Cirecie. We're going to jump now to covering a few of the questions submitted by our attendees with us live. The first one is, you said you develop programs in communities. Could you give me an idea of how to create these programs or what these programs are? Obviously, that's a very long answer if you want to go into detail, but maybe you can just provide some key points. If you're looking at developing a program in a community that is looking at trauma prevention and support, what are some of the key factors that you would want to consider?
Yeah, so key things are definitely you want to enter into the community. So a lot of times we make the mistake of going into a community. We just want to start doing work, but people don't know you. They don't trust you. And a lot of times we don't even get them. So it takes a while to enter into a community. Sometimes it takes years. How about that? So we want to definitely be genuine in our engagement with people. Second is we take a back seat to whatever it is that needs to happen. So we assist and facilitate, but it's really about asking them. In any of the communities where I've developed counseling programs, I've spent time embedded in the community and allowed the community to tell me what the problems are. One example that I often talk about, it might be in some of those credential programs that I've developed for MHA, is going into a community where the people who gave me the money to develop a counseling center said the problems were community violence, truancy for the children, and substance abuse. But after 2 years of collecting information, listening to the community and being there with them, I learned that that's what was seen on the outside, on the surface. When I went beneath, I recognized that there were relationship problems with parents, that the children were looking for and needed mentors in schools and in their community and so on. I learned a lot of things. And so the programs that we developed were very different from the programs that the funding source thought they were giving us money for. So it's important to go and listen to people, develop genuine relationships, and then help to build the things that they talk about as what they need.
Thank you, Cirecie. Great tips. The next question is, can trauma be caused by continuous string of events rather than a one-off like a disaster?
Absolutely. Certainly when you take a look at people who are minoritized, and it's been historical over time, it accounts for why, people in the 21st century have a lot of trauma symptoms from things that happened centuries ago. So it's been a series of events in which community people have developed coping mechanisms for and have communicated those coping mechanisms over time, in addition to new experiences with being culturally minoritized. And so those things become continuous in that sense. And of course, the number one thing to think about is in helping people to be able to address the trauma is for them to become advocates, for them to learn how to resist. That resistance is part of the intervention. It's part of what they need to have as their normal coping, to learn how to resist appropriately. And they need to tell their story, of course, to be able to talk about what is happening, because it's sort of like the gaslighting. People are being minoritized, it's causing stress, and people are saying, what's the problem? It's like, so we don't want to do that. So we need to help people to be able to learn how to talk about what they're experiencing, and to help people to understand it and appreciate it, and join them in the advocacy work that's needed, while also helping them to have the emotional regulation. And again, if we take a look at a lot of people who've experienced cultural marginalization, you'll find that there are a lot of mindful tools that are used. Some of them are evident in their spirituality. Some are evident in their sense of community. So you'll find that those things are embedded, and those things have been very valuable in their ability to be present today in whatever state they're in. It has allowed them to endure, to continue to fight. So yeah, definitely there is this issue of chronic stress that people experience, and in some ways it can be more difficult and more challenging to try to address, because a lot of times the activating event isn't present anymore. And so it's very difficult for people to be able to articulate what it is that's disturbing them.
See, and the next question is a good segue from this conclusion, which is, how do you distinguish traumatic stress from chronic stress or anxiety?
Actually, traumatic stress and chronic stress are pretty similar. I think it depends on which discipline is writing about it. Often in more medical literature, you'll find chronic stress is the term that's used. In more of the behavioral sciences like psychology and social work and counseling, you'll see traumatic stress, because that's how the studies developed using those terms. So you'll see continuous traumatic stress, CTS, you'll see traumatic stress. I would say race-based stress, historical trauma, they all fit into those categories. It just depends on which discipline is talking about it. I would say they're interchangeable, but what I can tell you for certain is that scholars have not come to agree on the absolute definitions of those things. It's like talking about burnout and secondary traumatic stress. Some people say they're synonymous. Some people say they're different. So there is an agreement on those things. It just depends on who you're talking to. So in the world, according to Cirecie West-Olatunji, they are synonymous.
I like the word according to Cirecie. Should write a book for children, The World According to Cirecie. Next question. When I began my work in trauma a few years ago, the definition of complex in complex PTSD was a trauma experienced in childhood. Has this changed?
I would say that not everyone considers that as the only form of complex trauma. There are other kinds of things that make them complex that don't necessarily happen in childhood, although a lot of things in childhood can create that. So I think that as we began to understand more about children and trauma, that we began to get these terms and so on. Today, I would say that complex trauma would include race-based trauma that is layered, multi-layered with other forms of trauma. So when you get things like certainly a lot of people who experience cultural marginalization over generations often also often, but not always, but often also have issues around poverty. And poverty alone, even if you're not a person who's culturally marginalized, poverty alone causes complex trauma. And there are secondary effects to that, like people then dealing with substance abuse issues, of people having, issues around health disparities, right? When we start looking at the social impact of poverty, of racism, and so on, we begin to see those things. We begin to see problems in terms of relationships and the irritability and the problems in terms of relationships. So we have these primary issues that are related to what I would consider to be complex trauma that may not be related to childhood trauma. There is that, but oftentimes they're interrelated. One of the things that I've been doing around these issues of trauma, particularly looking at race-based stress, is looking at the literature that talks about how early racism impacts children. And I kept going back, looking at these studies all the way to the womb to take a look at the disproportionate number of infant mortality related to racism that the mother is experiencing. So whether or not people even make it into the world has a lot to do with complex traumas. So there is a relationship between the two, in the sense that people who experience chronic stress or traumatic stress have probably experienced it early on in their lives. But there are also other complex traumas that don't necessarily involve childhood trauma as well. There are, a lot of people with brain injury that they've experienced that, and that could be combined with other kinds of trauma that is as impactful. So, pandemic, COVID, for example, could be combined with that, and so on. So there are other types of complex traumas that I would say don't necessarily fall in the category of childhood trauma.
Thanks, Lee. Next question. Where the stressor is a person who may be an authority figure in a family or a work situation, how would the traumatized person find a path to flourish? And again, situations like that can also include domestic violence and workplace-based stress. So that is some of the topics that you also talk about. So what are some of your thoughts in this area and how clinicians can help?
Yeah, well, the first word, I'm sure that most of you who are out there are already thinking safety. So safety is number one whenever someone feels unsafe in the environment, whenever they are subordinate to someone more powerful than themselves, whether it's a parent, a supervisor at work, or it is someone in the community. It could be a faith leader. It could be anyone who is over them, and there's a power dynamic. If they do not feel safe, and that doesn't have to be sexually, it doesn't have to be physically, it could even be just psychologically, they do not feel safe. And so the first order of business is always safety. What can you do to be safe? How can you ensure that there's a buffer between you and the person who's causing you harm? Is there any way that you can remove yourself from a circumstance. One of the things that I used to teach my clients, and certainly I work with children and I teach them as well, and I work with the parents to support children in that of taking control. There's a book that I used to give parents. It's called It's My Body. I'm sure it's very old right now, but it's a small book, and it teaches children to do the body scan when they're with a person and they're not feeling it, just doesn't feel good. They say, no, don't touch me. I don't like it. And parents have to honor that. So I have to tell parents, you can't say, oh, but that's just auntie so-and-so, or that's just grandpa, or that's just, you can't do that. If the child, for whatever reason, just isn't feeling that person, then you have to honor it and remove them. So it teaches children to be aware of their bodies, be aware of their feelings, and to follow those. If they're not feeling good about being with that person, if they don't like being hugged by that person, if they don't like being kissed by that person, then they have the right to say, no, you can stay over there and I'll stay over here. Hello. And that's it. So we have to teach our children that. But wow, I think adults need to understand that as well. So when I was in private practice, one of the things I would help my clients with is to be in touch with themselves so that they did not accommodate when someone was hurting them verbally, psychologically, physically. They would get out of harm's way. They would get to safety. And that would mean, hey, mid-sentence, mid-meeting, mid-conversation, they would say, excuse me, I have to go. And they would learn to remove themselves from harm. And that is a great first step to protecting oneself and understanding how to do that. Now, I have also worked with clients with, in one case I'm thinking of that comes to mind, I think the little boys were something like 8 and 10 years old. And they were in a terrible situation. That family situation wasn't so good. And I would ask them, do you have a grandmother to go to? Do you have grandparents? Is there someone that you could live with? Is there somewhere else you could go? And they said no, there was no one. And so what I taught them was, one, your situation is real. It's not okay. And it's pretty bad. So let's just get real. It's a shame that one would have to make children grow up so quickly. But I wanted to protect them. So I'm not going to say something is that it isn't. And so I said, yeah, you were dealt a really bad hand, like cards. You were dealt a really bad hand. And these are the things that you can do to minimize the impact of that. But as soon as you can, you need to figure out how to get out of there. And that could be applying to go to a residential school. It's like, hey, mom, I found a school I could go to. Or it is finding out that there is a relative that your parents might say yes to get you out of there. Or it could mean just getting old enough to emancipate yourself and getting out, but recognize that it's not a good situation and you're a bad kid. You're a great kid and it's a bad situation. So that happens sometimes too.
And Cirecie, I have one more question for you and then we'll wrap it up. And
Sure.
This one is quite specific. We have just initiated a trauma care track in our outpatient program. How would you prepare for possible dissociation? We have added a screening and criteria for that. Do you have any other suggestions?
Yeah, so I can't think of a screening instrument right now. Maybe some people already know and can pull that up really quickly. But I can tell you that I've worked with clients who've experienced that. Typically, it's related to incest at an early, experiencing incest, surviving incest at an early age. And so we've done some work with a labyrinth. I found that this particular tool works really well because they have gaps, with the dissociation. They don't know how they got there at all. And so I'm a very visual person. And this really helped me to use a tool that takes it out of their heads and puts it on the floor. They get grounded with that. And so what they do is take a sheet of paper, a large sheet of paper that you might write on, and I ask them to tell me where they began. What do you remember about where you were before you blacked out? And they would put that. And then I'd say, well, what happened next? And they would say that. And we'd write it down and put it down on the floor. And we would write that until we got to the blank space. And then we would do the next one of, and when you woke up, where were you? And they would put that down. And gradually what we would do is help them to not only walk that labyrinth, but they learn to take a different trajectory so that they didn't wind up there. They would actually stay conscious and take a different path. And we would actually pave that path by writing down what would they want to have happen and so on. And so that is one of the tools that I've used in dissociation. Of course, I've seen in psychodynamic work, I've seen people do amazing work of having them to go back. I've seen people use psychodrama. I've seen them to use brain spotting, EMDR. I've seen people to also use hypnotherapy as well in working with clients who experience dissociation. So there are a lot of tools that are out there depending on what kind of training you have. And I really emphasize that. And then also your theoretical orientation and what I think matches your worldviews, what your belief system is as a human being. It needs to be authentic. So find something that matches you and what works for you.
Fantastic stuff, Cirecie. Thank you so much. For those of you that are live or watching this on demand, if you want to learn more about Cirecie, go to the Mental Health Academy website, click the Experts tab at the top or link, and then just search Cirecie. Put her name down there, and it's going to be her bio full of links to her courses at MHA, including the 2 credential courses that we talked about. And we're also currently developing another credential course that's going to be released later this year. We can't provide much information about it now, but keep an eye on our newsletters because we're going to let you know. See, any final comments, suggestions, or things you want to say to people that are watching this right now to conclude the session?
Yeah, just a reminder that when you're working with clients who experience trauma, that you need to be in therapy yourself. You need to have a personal counselor who's working with you because it can really, really be very challenging. So do that for yourself. Self-care is so important for us who work with trauma clients.
Thank you so much, Cirecie. Thank you, everybody who watched this video or attended this live, and we'll see you next time.